Normally, I would say Happy Friday, Baylor College of Medicine, but this is not exactly a Happy Friday, and this has been a very, very difficult week for our country, our community, and for Houston, frankly. First, the numbers don't look so good. This week, we've had an increase in number of cases. New cases are now over 400. That's probably reflective of the opening of businesses a week or two ago. In addition to that, we're having more people in the ICUs. Our occupancy of COVID patients was 10%. It's been creeping up to 12, 14, and now 16%. So the good news is we don't have a logarithmic increase, but we're definitely increasing, and it's of great concern. We don't have yet the concern that we're going to exceed our capacity, but we're going to have to be very careful over the next couple of weeks and begin to anticipate that things are likely to get worse, particularly with the crowds that are demonstrating. Unfortunately, not everybody's wearing a mask for that. Last week I finished with what I thought was inspiring for me, which was the physician's oath. And you got to see all of our students take the physician's oath, and I want you to know I do that every year myself. And there's one line in the physician's oath that I want to read, which is, "I will not permit considerations of age, disease or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient." And just a few days later, George Floyd lost his life because of his race. I tried to make the point at graduation that throughout your professional career, and really for anyone, there are moments in life where you need to step up, where you need to intervene. And part of the problem, I think, is we have to recognize those moments. It's one thing to go through life and wait for moments, but you have to recognize those moments when you have to stand up and take a position and defend people. And I hope that all of our graduates and all of our faculty and everybody who's part of Baylor College of Medicine will do that. And I think one of the hardest things about what we witnessed is that no one stepped up for George Floyd. And the terrible thing is he actually asked for help. And I think one of the reasons it's so difficult for everyone and why it's so personal for everyone is there is a man asking for help, and no one stood up to help him. And I think that is just antithetical to being a physician. It's antithetical for a society, and it's just terrible. What's interesting to me is there are parallels with the COVID-19 pandemic. In many ways, this represents an existential event for humans. A global pandemic is something that really is a medical existential threat. If it's not this pandemic, it might be the next one. But we have to, as a species, be prepared that these are infections that can wipe us out. But systemic injustice and systemic racism is equally a problem. It's just as likely to wipe us out as a society as COVID is to wipe us out as a species. And I think we have to take both equally seriously. These are existential threats to us in our way of life. And I think it's about time we started treating them as such. And when I talk about stepping up, I really mean that all of us need to, whether it's individuals or institutions. When I sent a note out last week, and I mentioned my mother, and I got a lot of great feedback, and a lot of people were interested in my mother, and I thought I'd just use her as an example of somebody who stepped up. She passed away a few years ago, and 2 years ago, the New York Times ran an article on 5 women who changed the way we think about race in the United States. And one of those women was my mother. And she spent her entire academic life trying to preserve African American culture. And she did this by trying to find, she discovered slave narratives that were actually transcribed by individuals, and they were put in various locations in pharmacies and bars. And she found this huge treasure of African American literature and began to keep it and collate it and basically write critical works around the struggles of slaves that were trying to run to the north. And that was preserved in Indiana University. She also found this huge collection of early 20th century African American cinematographers and started a collection of black cinema, black film, that is at Indiana University today, over 3,000 films. And the reason was she didn't want this monument of African American culture to be lost. And the point is that she saw a problem and she stepped up and addressed it. Now, it's not surprising why she might feel this way. Her parents, my grandparents, lived at 4322 Alconbury Lane in the 3rd Ward. I used to spend my childhood going to that location in Houston in the middle of August every year. I swore to God I would never live in August. They had no air conditioning. It was so hot you could die. But that's what I did, and I could see why she was so passionate about that community, because she lived there. But you know, I'm just as happy about our own faculty and trainees. On Tuesday they went out to protest. They wore their white coats, and it was white coats for Black Lives. They stood in silence for 8 minutes and 46 seconds, the time that George Floyd was restrained. The great thing is they wore their face masks, they wore their white coats with Baylor emblazoned on them, and they stood socially distanced 6 feet apart. And in their silence, they stood up and wanted to make a statement against racism in this country. And I was very, very proud of them for doing that. I'm also proud of the AAMC, the Association of American Medical Colleges. The president wrote a very nice, very important op-ed, which basically said, you know, we can't be silent anymore. Academic medical centers need to speak out. We have the wherewithal to be influential, and we should do that. And I take that very seriously. I think we all should, and I think we as an institution at Baylor College of Medicine, one that believes in diversity and, more important, in inclusion, we need to take that seriously. And so I asked Amy McGuire, who is the director of our Center for Medical Ethics and Health Policy, to start thinking about excess mortality of African American men or people of color who encounter the police as a public health issue. When it's a public health issue, we look at mortality, excess mortality, and there ought to be surrogate markers that we can bring to light, whether it's stopping while driving or being frisked or being accused of a crime or incarcerated or sentencing. These are all things that if we start publishing heat maps across the country that really bring to light where there are discriminatory practices, we might be able as health professionals to begin to influence that conversation. And so I've asked her to create a position paper to represent our institution, to begin to have a voice to bring light to where there are societal issues of systemic discrimination, systemic racism. We want to be leaders, and we want to be the ones to speak out. Now finally, I know a lot of you, it's been a very tough emotional week for everybody, including me. Many people feel a tremendous amount of anger. Many of you are frustrated. I've gotten several people tell me they feel hopeless and helpless, unable to really influence what's going on. And I think we as a community need to come together. We speak louder as a group. The Baylor College of Medicine has always been a place that speaks its voice, that allows discourse. We not only believe in diversity, we believe in inclusion, and that means hearing people. When someone calls for help, hearing it, not just listening, but hearing that call for help. So we will speak out. We will support the entire institution. we will collectively try to influence. I'd like you all this weekend to take some time thoughtfully to deliberate about what has happened, but also to realize you have a lot of support here. There are a lot of people who feel the same thing you do. I, for one, do, and I'm happy to discuss it with anybody. We are providing support services for all. But I think more importantly that we all come together collectively with a single mission to try to eliminate systemic racism in our country. So have a thoughtful weekend. Try to be safe. And I'm just so proud to be part of a community that really cares. And so thank you all for raising your voices, and thank you all for being participants in what is one of the best institutions in our nation. So thank you so much. Thank you, Baylor College of Medicine.